Cool. Awesome. Hi, everyone. My name is Maritza. So just to mention a few things before we get started, as you saw, we are going to be recording this. We would love to see everyone's faces. And since we are recording it, it will be in the presenter view. So it'll only show the four of us who will be speaking. And then those of you who are viewing it, you'll be tiny up across the top. So if you speak, you won't become very large on the recording. As I said, we'd love to see everyone's faces, no requirements, though we totally understand. And then I'd love to know where everyone's joining us from, if you're able to put that in the chat so that we can know where everyone's coming from. And then if you're comfortable sharing, we'd love to know who you are. If you are someone who has OCD, if you're a loved one or family member, if you're a veterinary professional or a mental health clinician, we'd love for you to share that as well. And as Rachel mentioned, my name is Maritza. I'm a volunteer for the OCD program at CU Anschutz. I was a vet tech for about 5 years, and I'm starting graduate school to be a counselor this August. And I'll turn it over to the other three of y'all to introduce yourselves.
Let's see, Emily, why don't you go first?
Oh, okay. Hi, everybody. I'm Emily Hemendinger, and I am a licensed clinical social worker. I'm the clinical director of our OCD program, amongst several other things for the Department of Psychiatry. And I am the dog mom to a very handsome Australian Shepherd Corgi mix, Harrison Ford Hemendinger. And he is the love of my life. So I'll pass it to Stephanie. You're not a speaker today, but you're part of our program. So I'll pass it to Rachel.
Great. I will introduce Stephanie. So Stephanie is the secretary of the Colorado chapter of the OCD Foundation, OCD Colorado, and she helped coordinate this talk. We also have Tammy Roblick here, who is president of OCD Colorado. And I am Rachel Davis. I'm a psychiatrist at University of Colorado Anschutz. I'm medical director of the OCD program, and I currently own 2 tiny dogs and 2 parrots and 2 budgies. And Dr. Hogan.
Hello, everybody. My name's Dr. Sarah Hogan. I am an emergency veterinarian and medical director, and I have been an emergency veterinarian for 20 years. And the reason I was asked on this talk is because I've actually done 2 TED Talks, one on the emotional costs of euthanasia and one on pet loss grief. And that is how I became associated with with this incredible panel of professionals, and that's why I was invited to participate. So it's nice to meet everybody.
And thank you. We're thrilled you joined us. Is it okay with you if I kind of put the links to your TED Talks in the chat at some point here too?
Absolutely.
All right. So I don't know if people heard, but we would love to hear where you're from. So I saw some people putting it in, but if you could just let us know what part of the United States or world you're in. I know we have some people from other countries, which is exciting. One of the things I want y'all to keep in mind today is this is meant to be an open discussion, and we are not veterinary professionals, and Dr. Hogan is not an OCD specialist, and so this is really going to be an open dialogue. If one of us says something that doesn't sound quite right to the other, we can kind of have a conversation about that. We're going to start out with just a brief overview of how OCD interacts or can interact with pet ownership. Then we'll do some Q&A examples, and then we'll kind of open it up to the audience, and we'll go from there. So if you think of questions as you're going along, feel free to go ahead and put them in the chat, and turn it over to Emily.
It's actually
Oh, I guess we're going to jump right in. So OCD in animals and how it connects. So do animals have OCD? And I'm going to let Dr. Hogan start with that one.
They have about 75%.
I brought the boy back.
So to answer the question, yes, definitely OCD is well documented in animals. In dogs, it has a slightly different name just because they tend to change names slightly for veterinary medicine than for human medicine for certain ailments or conditions. One example of that, completely unrelated to anything, is I'm sure you've heard of jaundice in humans. We call it icterus in animals. Exact same thing, different vocabulary word. For dogs, if they are diagnosed with OCD, it is called canine compulsive disorder, but it very much is parallel to and overlaps with OCD diagnosis in the basis of clinical manifestation, as well as underlying etiology that precipitates and manifests as a behavior. There appear to be, in what they've documented in dogs and overlapping with human OCD, there's a genetic foundation, and it is affected. Individuals affected tend to have kind of an anxious personality, and they seem to be, it's precipitated by an environmental stress. So if your dog is manifesting symptoms, there may be certain environmental triggers that you can recognize to try to help prevent OCD or CCD episodes. And it starts with a displacement behavior in response to a stress, and then the behavior tends to become fixed. And the behaviors are typically hyper manifestations of ordinary survival mechanisms, such as grooming or eating or something along those lines. So that is a long answer to a short question. Yes, we recognize OCD in animals.
And so I have an example of something similar to OCD. It would be more similar to what we would call a related disorder in humans, or hair pulling disorder or skin picking disorder, trichotillomania. I have adopted Chula. She's a Sunday conure, so a mix between a sun conure and a Gen Day conure. And I adopted her about a year ago when she was 18, and she was completely bald, not completely bald, bald like this. I don't know anything about her history, but she ended up at Parrot Rescue, and she has basically plucked out all the feathers within her reach on her abdomen and then the top of her back. And so, one of the problems with her is she's picked so much under her arms that she has scar tissue. So if she extends her wings, she bleeds. And so I have to be very careful with her. There's been a couple times that she has bled profusely because she's tried to fly or whatnot. So I'm going to show you a video of her coming home from the vet after one of those instances. But basically, it's similar in animals. You can treat it both with medication and with behavioral strategies. And so in Chula, one of the things about her that stood out when I got her is the only toy she was interested in was that little felt fleece thing. She wasn't interested in shredding or chewing or anything. And so one of the things I've worked with her on is to get her interested in actually shredding toys. So putting some little sunflower seeds in the toy so she'll actually do it. And I will say it's been successful. She's now shredding some toys. And then medication wise, she has severe arthritis in her feet. And so you can see she's kind of picked at around her feet. So one of the things we do is to treat the pain, because she could be, targeting her feet because they hurt. So I'm just going to show you a cute little TikTok I made of her coming home from the vet after she nearly made herself bleed to death.
With it, group drop.
Okay. So one of the things you can see is that sometimes when she has picked too much, I do have to put a little kind of dress collar on her. But if you think about it, that's not ideal, right? Because that would almost be like taking someone who has hair pulling and putting gloves on them that they couldn't take off. So sometimes I have to do it to keep her safe, but it's not ideal. So, and then Emily, I think, has an example.
Yeah, so our talk today really is about so many different things, but one of them is one of these topics that we're talking about is how obsessive compulsive disorder or canine compulsive disorder or obsessive compulsive umbrella disorders can show up in animals too. I have, as I mentioned, my dog Harrison Ford. He when I adopted him, was quite anxious, a lot of separation anxiety, and he's one of those animals that has a very anxious temperament, and he has some compulsive behavior, especially around plaguing with a particular green ball. And this is just one of many videos that I have taken of him. And so he will go back and forth and always go to the same spot and drop it and run back and forth. And sometimes get overstimulated, and sometimes it helps his anxiety. But as we know, sometimes, you know, our compulsions actually don't release that anxiety. So that's my dog.
Can I add something on his video? So he said he's a Corgi Australian Shepherd cross, right? So, and the genetic underpinnings, those are two herding breeds. One is used more commonly for herding sheep. One is used more commonly for herding cattle, but it's still a herding behavior. So he has to have control of that ball. He has to make it go where he wants it to go, when he wants it to go there. He has to get it to the spot where he thinks it belongs. And then he's like, okay, that feels better. Then he takes it back to the spot where it starts. So he's herding the ball, and that's, you know, he's doing exactly what his engineering, exactly what he was literally bred to do.
It's very true. And I relate it to when I'm talking to people I treat with OCD. You know, we talk about how compulsions, they can be so ingrained and we can get so absorbed in them in the moment that we often might forget about other or be so absorbed that we let other parts of our lives be neglected. And this is true of my dog. He will play with that ball. If I don't take him inside, he will play with that ball or take the ball away. He will play with it for hours and hours. He won't go to the bathroom. He won't drink water. He won't, like, treats rarely get him away from this ball too, except for like maybe cheese or bacon, but those are high value treats. So just like with compulsions, sometimes, you know, we might neglect other areas of our lives. And I think it can help to relate sometimes to our animals as well, to help with that connection. Oops, nope. So we have a couple different questions that we are going to start with, but if you have any other questions, please throw them in the chat. But we answered, you know, like, do dogs and cats, do animals, do pets have OCD? And we're briefly going to go into kind of how does OCD, what are some examples of how OCD interacts with pet ownership? We're going to give some examples as well. And later on, we have different examples of how to do exposure response prevention around pets and our animals, as well as how loved ones can support. And we're also going to talk about, you know, is it normal for my pet to be my person? And why do I feel so much grief about the loss of a pet? So first, we're going to start with, how does OCD interact with pet ownership? Also, animals on these slides are all of our animals and have consented to being in our pictures. So just some examples of how OCD can interact with having a pet. It could look like guilt about having to leave pets at home or alone, immense guilt and anxiety that they're not going to be okay, that something might happen to them, this overwhelming sense that, you know, you can't handle leaving them alone, or they're going to be sad and not being able to sit with that. There might be guilt around behavioral training or scolding them, or even like setting boundaries with your pet. You might have health anxiety about your pet's health, so bringing them to the vet excessively. Googling just as someone with their own health symptoms might be searching WebMD. You can do the same stuff for your pets. There are contamination concerns. Sometimes when I'm working with people, they have a pet who they truly love. They can't touch that pet without washing their hands raw, or you know, not even having the pet near them because of those contamination concerns. There are also people who have maybe harm-related themes, whether it's like fears of harming their pet, or maybe they're sexually attracted to their pet or might do something to their pet. There's the fear of being a bad pet owner, and a lot of that scrupulosity. And then some obsessions around death and dying, and some existential themes around pet, not being able to handle when your pet passes away. And
I'm
then
gonna jump in really quick and just say, I don't know if everybody on here is familiar with OCD. If you're not familiar with OCD, obsessions or fears are what we call ego dystonic. So, you know, someone who is afraid they might be sexually attracted to their animal is not actually sexually attracted to their animal, but their OCD tells them they might be. Or someone who's afraid they're going to harm their animal is probably the least likely person to harm their animal. So they're not actually at a risk, because what their fear is something that goes against their values. But that's why it's so painful.
And a lot of times with OCD, some like the obsessions or the fears might be based on something that everyone has anxiety about, right? Like even if you don't have OCD, you might be like very concerned about an animal, your loved one, you know, having some health issue. It's more when it starts to become impairing and distressing and ego dystonic that it really gets in the way of your functioning and falls on that OCD spectrum. Just a few more of how OCD interacts with having a pet. Good old reassurance seeking. So this is a very common compulsion. And this looks like asking repetitive questions. If the pet's going to be okay, do you think it's all right? Maybe taking them to the urgent care a whole bunch, or going to the vet, emailing your vet a whole bunch, compulsive researching, as I already mentioned. And then sometimes people with OCD, because there can be difficulty connecting with others and a lot of shame around their symptoms, or feeling like they can't be vulnerable about what they're going through, their pet might be their primary relationship in life, which then leads to a lot of grief and loss around a pet's illness or death. And somebody with OCD also might have a lack of resources because of how impairing OCD is. It can really impact someone financially, and if they're able to have a job or not. So they might have a lack of resources to properly care for a pet. And then finally, as Rachel was mentioning, that skin picking and hair pulling that humans have, sometimes what I've seen in my practice is it's this skin picking or hair pulling that someone does to their pet. And it's very similar in that compulsion and that body-focused repetitive behavior. Rachel, do you want to share your example first, or you want me to share mine first?
You go ahead since you're talking, and then I'll jump in.
All right. So hi, I'm Emily, and I have OCD. And my OCD is around a number of things, but one area that it focuses on is on health, and occasionally sometimes my dog's health and safety as well. And the example I'm going to give of how my OCD interacts with my dog is 2 Christmases ago, I had a Christmas tree, Christmas lights, all of that. My partner and I were going to run an errand, and I left my dog at home. I normally turn the lights off, unplug them before I leave, just out of habit, and I forgot to do that. I was running this errand and was flooded by intrusive thoughts and intrusive images and fears of the house getting set on fire because I left the Christmas lights on and my dog dying a horrific and terrible death because of my carelessness. So we've got some hyper responsibility themes going on there. And my initial reaction was, and the compulsion I wanted to do was immediately return home and like not be out running the errands that had to get done at that moment. And I also wanted to seek reassurance, and I wanted to check, and I was kicking myself because I didn't have the Furbo camera on, and there was so much immense anxiety in that surge, that emotional reaction that we have when we get an intrusive image or thought is really what gives the OCD power, right? Because if we had these thoughts and we didn't have an emotional reaction, it wouldn't be an issue, it would just be a thought, and we'd be able to let it go. But because of that meaning making that we have when we that people with OCD have when we have that intrusive thought, that's what makes it distressing. What I did was I wrote it out. I wrote the initial anxiety, and I did tell my partner what I was experiencing, and he kind of gave me a look of like, what? Like that is, you know, that doesn't make sense. And like Rachel said, these don't necessarily make sense, or they're not in line with, you know, what we believe or what we want. And that's the frustrating part. But sharing it and sharing that I was going through this immense anxiety was helpful for me. I wasn't provided with reassurance, but I was able to talk about it and talk about what I needed to do. So that's my example.
So I'll give an example too. So I am Rachel, and I also have OCD. I've had OCD since I was a kid. I know sometimes in the OCD community, people feel very strongly about not saying that there's anything good that comes from OCD. But all I have known is ever OCD. My brain has always had OCD. So for my ability to move forward in life, I do have to find some positives from it. And so I think that some of my characteristics and traits that are related to OCD and can sometimes become out of control are also traits that sometimes serve me well. So I'm extremely conscientious. I am very empathetic. I'm very detail oriented. And when those things are out of control, you know, they cause problems. I also, one of my primary themes, especially when I was younger, revolved around health or health anxiety, hypochondriasis, and also excessive responsibility, and then often a fear of doing something wrong. So about 4 years ago at this point, my at that time 10-year-old miniature pinscher was diagnosed with diabetes, and it made me extremely anxious. I think it makes most people extremely anxious because it's hard enough to control blood sugar in someone who can tell you how they're feeling, let alone, you know, a dog who may not even show signs of hypoglycemia until it's really, really low. And so this is where I think my the positive aspects of OCD, which again, I know some people probably don't like to say that, but I think played in and helped me. I actually developed what I think was a pretty cool way of managing her diabetes. And so I found out that I could get a Freestyle Libre sensor for like $36 for 2 weeks and put that on her. I found an easier way to check her blood sugar using a little like suction thing off of her back instead of having to poke her ears. And I actually got the Libre sensor. I did a lot of Googling and found out that you connect it to a Bluetooth transmitter so that the Bluetooth could then share with my phone. So I could see what her blood sugar was when I wasn't at home. And then I had a Furbo dog camera, which I figured out I could dispense jelly beans when her sugar dropped too low. So she was very brittle. She also had chronic pancreatitis, which she was on prednisone for. So her sugar was all over the place. She ended up on 3 different insulins. But she lived for 3 years with that. And I think because I was able to come up with that system. Now, where I did get compulsive is I was constantly checking my phone. So, you know, anywhere I was, it was hard to not always be checking at my phone for fear of if I didn't look frequently enough, she might become hypoglycemic, she might have a seizure. You know, fortunately, a lot of that was during COVID, so I was able to be home with her a lot more than usual. I would say it probably became a lot more all-consuming for me than it probably would for most people. And the other thing I want to say is Zia had a fantastic internal medicine vet, and I'll just give a shout out to Dr. Kathy Scott at VCEA Alameda East. She was incredibly patient with my questions. She was interested in my questions. She was curious with me. You know, and I tried to rein it in so I wasn't excessive, but just her willingness to think things through, and not necessarily, she didn't provide excessive reassurance, but she, you know, helped me problem solve. And that was incredibly helpful. So we're going to jump into some questions, right? Do you mind going back to that list, Emily? So let's start with, how do I manage anxiety about my pet's health? So I think my story is kind of a good segue into that. And I'm curious, Dr. Hogan, you've probably worked with people who are anxious about their pet's health. How have you gone about helping someone with that?
Make sure I'm off mute. So I've been an emergency doctor for 20 years, and I was the overnight doctor for 12 years. So, and it seemed like we would see clients who likely had OCD. Nobody ever volunteered any diagnosis of their own with me, but I think I'd see them more at night. And we had one lady come in who, you know, was convinced that her dog had something really serious happening, and would come in night after night after night very concerned. And it wasn't fair to her, because as an emergency hospital, we'd have to do triage. And so she would end up sitting there and waiting for hours, very worried about her pet, because her pet in the triage tree, you know, the organization of severity actually was very stable. And so all of these much more critical animals would be seen before her. So we recognize this is, you know, this is a problem that we really need to solve for multiple reasons, because it's not fair to her, it's not fair to the pet, it's not fair to the staff there. I mean, there's just a lot of things that we needed to really address. So sitting down, and first of all, I really listened to her. And that's something that I think unfortunately can be lacking sometimes in healthcare professionals and in veterinary professionals. And I don't think it's out of disrespect or vitriol. I think it's partially a byproduct of how busy they are. And we aren't in vet med, we aren't trained necessarily in ways to work with people that maybe don't present as 100% straightforward. If you walk in and say, my dog hurt his foot and now he's bleeding and he needs stitches, okay, we're fully equipped to deal with that. If somebody says there's something authentically wrong with my dog, he's drinking too much, or he's urinating blood, or he's doing something, and there's a tangible clinical sign, we can definitely run with that. But if somebody comes in repeatedly to you and says, I'm sure there's something wrong, and you can't find anything on physical exam, I think that's where a lot of veterinarians suddenly feel kind of stymied, and they're not sure of appropriate next steps to take, because ethically you don't want to run $5,000 worth of tests on a dog. But at the same time, you want to see if there is a problem. But if you've just done blood work and you've just done x-rays and the person comes back the very next day and there's no clinical change, then I think you feel kind of overwhelmed and kind of unsure what to take for the next steps. So what I did for that client, first of all, is I really listened and I talked to her and found out, what are you truly worried about? And she was very worried that there was something terminal happening with her pet, that it was dying. And so what I did for her is I basically made her what I called a roadmap, because in my own life, when I've had people that were sick, I did much better if I had a roadmap. And what I meant by a roadmap is I needed tangible things that I could actually utilize as a measurement to, if, like, when my first husband was dying, they said measures oxygen saturation. If the pulse oximeter says that he's below 93% in room air, put the oxygen on him. Okay, no problem, I can absolutely do that. So what I made was basically kind of a triage sheet for her, and explained that if here's a quick, easy physical exam that you can do in 30 seconds at home to evaluate how your pet's doing. So first of all, look at their breathing when they're at rest. If they are breathing fewer than 36 times in a minute at rest, so calm, not panting, excited, just came in from outside, then less than 36 breaths a minute is normal. Look at their gum color. If their gum color is red, white, or blue, that's a problem. Look at, when they go to the bathroom, look at their stools. If you're seeing blood, if you're seeing, profuse amounts of diarrhea, then start by calling me and we can talk about what we just eaten. So basically what I was trying to give them was tools that they could use, that she could use to solve the problem herself. And that way she didn't have to come in unless she had something that clearly was an indication there was a problem. Gums are white. Okay, that means that we're either having a circulation problem or we're having a bleeding problem. Gums are blue. Okay, we're not getting enough oxygen. Why is that happening? Gums are red and injected. Okay, I'm worried that we're either in hyperdynamic shock or we potentially have an infection. Is that a sign of sepsis? So those, going through that conversation, giving her something tangible and explaining what each of those clinical signs would mean. This is what white gums mean. This is what blue gums mean. This is what red gums mean. Helped her feel empowered. And she was able to basically take a situation, objectively analyze with what the symptoms that she thought the dog was showing, compare them to the list that I gave her, and then she was able to diffuse her level of concern because the evidence didn't support it. So that is how I've helped, one client for sure that I knew had was manifesting symptoms that I believe were OCD, with her inability to not come in to the hospital at night when she was worried about what was happening with her pet.
Well, and I think it's so important that you listen to her, because I think what you highlighted on is a lot of people would probably just tend to be annoyed and think, I don't want to deal with this. I don't have time to deal with this. I mean, it's certainly something we see in human medicine. And it sounds like just making time to hear what was going through her head was a huge first step. I'm curious, do people in the audience have reactions to that, or questions to pivot off of that, or thoughts? Feel free to raise your hand or put it in the chat. Your own experience with anxiety about your pets. Ali says, as a pet owner, I appreciate your patience and thoroughness when speaking with owners.
Thank you. That's a compliment that I very much appreciate.
Yeah, Liz, I see you have your hand raised. What question do you have?
Oh, hi. I am. First of all, I am loving your Zoom, your conference, your talk. It is great, really. I am loving it. And I am a CBT. I am a psychologist here at Mexico, and I treat OCD. I have not had a patient with OCD for their pets, but I had a friend that she didn't recognize, and she didn't want to treat it. She lived with it. She had these huge white dogs, Gigante de los Pirineos. I don't know how to say in English, but Pirineos, I don't know. This huge dog, Shen was her name. She died at 12 years, almost 13. And since she was a puppy, she brushed her hair, and she combed the hair, and lo guardaba, and she was packing all this hair in pillows, like if there were pillows, and she had a huge amount of hair because she was taking it with her because I'm sorry, my English. When the
Yo puedo
dog.
traducir si quieres también.
Maritza. Ella guardaba el pelo. Muchas gracias. Guardaba el pelo para cuando muriera. Entonces, desde chiquita, desde Poppy, hasta casi 13 años, tenía.
So she's saying that ever since her Great Pyrenees was a puppy, she would brush her, and up until her dog turned 13, she shaved all of that fur because she felt a lot of fear around the death of her dog.
And once the dog was dead, she studied a lot how to knit scarves, pillows, hats, because she wanted to fill her dog with her. So she dedicated a lot of time. Now I don't know too much of her. She's living at Germany. She needed en barco, Maritza, envió en barco todas estas almohadas para llevárselas con ella a Alemania, y pues se deprimió y estuvo muy mal cuando su perrita murió.
So she's saying when she moved to Germany, she like mailed all the pillows made of the fur to be like in her presence, in that she was very depressed once her little dog, well, her big dog, passed away, because she missed her a lot. So I think estás preguntando si esto es una síntoma de tener OCD.
No, yo estoy segura que era un OCD, ¿no? Que yo no la pude tratar porque era mi amiga y ella no permitía esta ayuda. Ya se fue a vivir a Alemania, pero era como un ejemplo de grief, de duelo, y desde que era bebé ella estaba pensando en cuando muriera.
So she's saying she wanted to just share that example of how OCD affected her relationship with her dog since her dog was a puppy, because of the fear she had around her death.
Well, thank you very much for sharing that story. And I think that it's very poignant, and it is a good segue into one of the other questions we listed on this slide is, why do I feel so much grief about the loss of a pet? And I think, you know, most pet owners feel immense grief when they lose a pet. I think people with OCD are more prone to feeling heightened negative emotions and feeling them when they don't necessarily, when it's not adaptive to. And so we may worry about our pets dying from the minute we get them. And if we have OCD that focuses on it, as your friend did, Liz, we may constantly be thinking about and preparing about it way early on, and it may always occupy part of our relationship with our pet. And so I thank you for sharing that example. And I'm curious, well, I'll come back to this because there's some comments in the chat I wanted to talk about or make sure you all saw. So someone asked Dr. Hogan, how did that impact the woman's, sorry, I'm having trouble seeing it. How did that impact the woman's visit to the ER after the roadmap exercise? And Dr. Hogan said, after she received the roadmap, her visit stopped for a year. The next time she came in, the dog was ill with vomiting and diarrhea. And yeah, someone says, oh, wow, thank you for sharing. So that just goes to show how much listening and taking someone seriously can actually make a huge difference. Anybody else relate to the grief or have questions or thoughts about grief related to losing a pet?
I mean, I'll share real quickly that the first time I experienced death, it was my childhood pet. And that kind of shaped my perception of like the finality of death, because that's something that you can't go back on. And it was so, I mean, yes, traumatic, but also like changed my perspective on how important it is to spend time with my pet while they're still with me. And I mentioned this when we've met before, the four of us speaking, but my parents always taught me that when you have a pet, it's kind of like you have a baby, but then towards the end of their life, you have a grandparent and you like experience that whole life cycle with them. And there are some things that are similar with the death of a human, but it's so unique in its own sense because you experience that whole lifespan with them. So I think that's one reason why we can experience a different kind of grief when it comes to our pets.
I also just wanted to jump in and validate anyone who struggles with that fear or their OCD focuses on that. You know, as you might be aware, OCD really focuses and attacks the things that we care the most about. And especially if our dog is our person, or even we just truly immensely love our dog, the OCD, of course, is going to attack that. And on the other hand, death, dying, there's so much uncertainty around that. And OCD is also like inability to sit with uncertainty. And so you combine those two things, like, of course, you're going to feel distress around it. So just to validate anyone who has ever experienced any of those thoughts, fears.
And I will echo that. So, you know, during COVID, when Zia had diabetes, Zia was very much my person. And my dogs now are very much my people. And when Zia died, I was incredibly sad. And one of the things that was so helpful is that my friends, the people I worked with, including the people on this call, were so supportive. I got flowers. They made me necklaces with Zia's name on it. They brought cookies over. Just to be validated in that way and have people understand my grief and acknowledge that it was real was so meaningful. And so, you know, I guess what I would say is if you have people in your life who lose pets, you know, it is very meaningful to reach out and do something and recognize that grief. Dr. Hogan, do you have thoughts about this or stories to share or anything?
So one of the things that isn't talked about enough in our society is that pet loss grief is different than losing a human. And, you know, there's really a multitude of reasons why, but I think probably the most pertinent reasons as it relates to the topic of this phone call is twofold. One is your relationship with your pet is really incredibly intimate. And I mean intimate in the way that it is so intrinsic to the fabric of your life that if you took the pet out of that, like pretend it was a piece of fabric and you took the pet out of that fabric, you don't recognize the fabric anymore. They're that intrinsic to the pattern because, you know, you wake up, and for a lot of people, they do sleep with their pet. That's, you know, completely 100% normal. Having your pet share that space with you. And then so they're the first thing you see when you wake up. You go downstairs together while you're making your coffee, you're making your tea, you're making your breakfast. They're right there, and you're probably making their breakfast as well, whether that's filling their food bowl or opening their can of food or, you know, whatever your morning ritual is. And then if you're lucky enough to get to work from home, or whether it's a day off, you probably take your pet for a walk. And then on the walk, you probably see familiar faces. And on that walk, that's your social liaison with that person. Oh, you're, you know, you're Pepper's dad, or you're, you know, Buddy's mom. And even like in my own house, I currently have 7 dogs. I have 7 dogs, 3 cats, and a parrot. And so they're a huge part of my life. And, you know, I literally can't walk anywhere in my house without having an animal talking to me, interacting with me in some way. And so that's the intimacy that I'm referring to. So if that's gone, every single part of your day is a reminder that they're gone. You wake up and you're alone. You go down to make coffee and there's nobody else to take care of, or there's one less to take care of. You know, I can tell you when we lost our last dog that we lost at Christmas, you know, I'd always bring home leftovers from the restaurant, cut up the steak, and I cut 6 pieces. I only had 5 dogs. And then there's that leftover piece of steak on the cutting board. And it's like, yeah, we lost Tinker. So that's, you know, it is so ingrained in part of your day. So that's one way it's different, because for a lot of adults, you know, if you lose someone that you're close to, you don't necessarily live with them. You know, I don't live with my parents anymore. I didn't live with my grandparents when I lost them. I have 3 siblings that I adore, but I don't live with them. They're in different states. I don't get to see them every single day. So that's what makes the difference. The other facet with pet loss grief that I think is particularly pertinent to this community, to this, you know, call and what this is about, is our pets in no way judge us. They look at us and they tell us every single day, you are perfect. You are so perfect in my eyes. And I am so glad that I have you. And it doesn't matter if you put on 30 pounds with COVID. It doesn't matter that you messed up a presentation at work. It doesn't matter that you got a speeding ticket. It doesn't matter that you have OCD. In their eyes, you are absolutely perfect. And for some people, unfortunately, that's the only person in their life that gives them that feedback, that I love you the way you are. And so that is what makes losing a pet so much more painful and different than losing a human. Because even if that human in your life is really, you know, wonderful and supportive, humans tend to have a lot more opinions than dogs and cats do. And, you know, we'll tell you things. Sometimes you don't necessarily want feedback, but it's volunteered. And so that's the difference.
Thank you. That touched on a lot of things that I can certainly relate to. And to add on to that, I think one thing with Zia that was different is I've had people in my life who, when they're ill, they don't let me take care of them. They kind of push away and whatnot. And your pet, your animal, they let you take care of them. I mean, they may try to bite you when you try to give them insulin, but ultimately you can do what you can to care for them and make their lives better. They don't have the ability to kind of shut you out or whatnot. And so I think just that ability to really be able to care for something with all that you have and not have it rejected also makes it very hard when they die. And I think I wanted to go to a couple of the questions in the chat along these lines. Someone asked, how do you prepare for the death of your pet? And then someone else asked, sorry, I'm having trouble pulling up my chat for some reason. Okay, so how have the people who have disclosed living with their OCD managed preparing for the pet's death? And then what is the difference between obsessing about a pet's loss before the pet actually dies, but after their health has started to decline, and anticipatory grief? How can you distinguish between the two? Can both occur simultaneously? So I'll take a first stab at it and then I'll turn it over to other people. I think obsessing is anticipatory grief gone overboard. So when you're obsessing about your things are often on a spectrum, right? So when does something become compulsive or obsessional? When it probably starts to interfere with your functioning more than it would someone without OCD. How do you prepare for it? I think one of the things I've learned that has helped me the most in living with OCD is to just sit with and feel the painful feelings. So the more I try not to worry about my dog's potentially dying, the more I try not to feel grief, the more I feel like I need to do something. So I stop thinking about this and stop worrying about it, the stronger it gets. So I just accept that I, going throughout life, will feel a lot more emotions, including a lot more of painful emotions than maybe people without OCD. But if I accept that and learn that I can feel grief at the same time I can feel joy about my dog, then I can move forward and at least I don't lose the joy. But I'm not constantly trying to get rid of the grief. So I can have both at the same time. And so that's been my way of dealing with it, is I've just recognized that I am not going to get rid of the grief. It's going to be there. So I'm going to learn how to also feel joy and enjoy being around my animals at the same time.
I can echo that because I think like the answer to the question, like, how do you prepare is, I mean, you can't really prepare. But that's what OCD is, right? It's almost this need to find certainty. It's this need to find, if I do XYZ, then I'll be ready for it. I'll be able to handle it, right? But that's not how it works, because in the moment, we're not going to know how we're going to handle it. Even if we do all the things and we're over prepared for it, we can't even imagine what that's going to feel like. And so there's that acceptance piece, right? And there's this mindfulness piece of, if I'm focusing so much on the future, I'm not actually enjoying the present moment with my animals. I'm not actually able to be with them and enjoy the time that I have. And it's sort of like you can use some non-engagement responses, right? Of like, yeah, it's going to suck. When my animal dies, it's going to suck. And I'm going to handle it when the time comes. I'm not going to spend my time right now doing this. I'm going to handle it when the time comes. And like refocusing on that present moment. So it's a lot of mindfulness. It's a lot of acceptance. And it's a lot of like Rachel was saying, like really focusing on enjoying the time you do have.
And even if you have experienced the death of an animal, I think personally that each experience is different. Like it won't feel the same. Each kind of love is different. And so that grief process will also be different. So just as both of these ladies have said, it's very hard to prepare.
Well, and just to be honest about my own ability to prepare or not try to prepare, I will admit that as Zia was getting older and more sick, I did go out and buy an AED, a defibrillator, and I bought baby paddles. So I had that. That was a bit compulsive. That was more than $1,000 purchase. Fortunately, I was wise enough not to actually use it when she was dying, because that would not have been good for her or anybody. But, you know, I was compulsive in that sense. I wanted to be completely prepared. And so I had an automatic external defibrillator in case she went into sudden cardiac arrest. That was excessive. I still have it though.
You know, if I can add something, I think that, you know, as an emergency veterinarian, good news just simply doesn't come see me. I don't do well puppy visits. I deal with a lot of end of life things. And I've, you know, delivered terminal diagnoses to families. And so I've watched them process going from, I brought my dog in because he's limping, to the reason he's limping is he has a pathological fracture because he has cancer in that bone and it's spread everywhere. And this is a battle we're going to lose in a very short period of time. So, you know, I've watched that transition from this is nothing to, oh my God, this is my worst day ever. So what I would advise people to do in that situation is, first of all, make sure that, you know, what I tell families is, I know this isn't what you're anticipating, and I'm sorry. And it's okay to feel ambushed by this diagnosis, because it's the horrible reality. This diagnosis did just ambush you. So what I think that is reasonable to do at this time is, you don't have to make a decision we can't reverse right now. We'll control his pain. And then if you feel like you need to take him home and have a little time to get your arms around it, that's okay. That's valid. So I want people to know that they can give themselves some grace. You don't have to take this horrible news and bludgeon yourself with it. You can, you know, you can't ignore it like it doesn't exist, but you also don't have to impale yourself on it. Acknowledge that, yeah, this authentically is the worst day of my life, and this is something that I've been dreading. So now let's give you some tools to try to handle that. First of all, can we control their pain? Can we control their nausea? Can we optimize the short amount of time that they have left? Next thing to do is tell them, I mean, I honestly tell people, take some time to tell your pet every single thing you need to tell them. Say it out loud. If you need to write it down, write it down. But tell them every single thing that you need to tell them. And third thing to do is make sure that you talk to your support system. And if you don't have a support system, try to find a support system. And if you don't have anybody else, you can bring him back here for euthanasia, and I'll be your support system, because I recognize how you feel, and it's real and it's valid and it's okay. So try to empower people with the tools that we do have at hand. Can we control symptoms? Can we take the time to really say goodbye? And then can you know that you're not alone, and have your feelings validated, because they are real. And so then you're not left after the fact beating yourself up for feeling the way that you feel, even though it's 100% valid. So surround yourself with people that see you and recognize you and affirm you in positive ways, in that, yeah, this was a horrible loss and your grief is valid and it's okay. And then maybe try to, if you can, make a next steps plan. And by next steps, what I mean is, okay, when you go home, there's going to be a dog bed or a cat bed. There's going to be dishes. There's going to be leftover food. There's going to be all these reminders. And instead of looking at those like a little piece of pain just sitting there mocking you, decide what you want to do with those. Do you want to just put them in a cupboard and not think about it for a while? That's okay. You can 100% do that. do you feel like you want to try to pay it forward for another animal and make a difference in their life? Like take those things to a shelter and donate them. Do you feel like you want to hold on to those as keepsakes? Okay, that's fine. Do you want to do something special with them? Like, make a pillow out of it, or put it with a picture, put your favorite picture of them in a nice frame in their dog bed, and put it on a shelf where you can see it and think about it in a positive way. So once the pain subsides, then there's a happy memory there. Just like when I lost my grandfather, I kept his eyeglasses. I was never going to wear them, but when I looked at him, those were the first thing that I saw. So put those eyeglasses with his picture. And for a while, it was really hard for me to look at them. But after a while, it's like I looked through those seeking advice and guidance and counsel and love and support 10,000 times. I didn't want to lose that. So that's what I kept. And that's what I put with this picture frame. And when my dogs have passed, I kept their collar, and I kept it because each of my dogs has their own collar with their own tags. And when I call everybody to come stampeding into the kitchen, they each have their own music that those tags make. So I couldn't lose that music. And so I keep that collar. And if I'm really missing them, call everyone in the kitchen for a cookie and shake the collar, hear that music again. That's the symphony of my life, my pack, their collars, the music we all make together. So it's, there's ways that you can cope with stuff, and it doesn't have to be a textbook way. It's what's intimate and personal and real to you based upon the life that you've built and you've shared with your pets. So again, sorry, long answer to a short question.
And I'll tell you, I never got rid of Zia's beds. I kept them there until I found another rescue I was ready to rescue. And then they started using her beds, which felt good because it was like now Zia's bed is being used, and well, her mini beds are being used. And it was like she was passing on a gift to my new dogs. So that felt nice. There's a question, besides medication, how do you help a pet who has OCD manage symptoms? So maybe we can touch briefly on that. And then I want to see if anybody else has anything else for discussion before we kind of jump into some exposure and response prevention ideas. So I'm guessing the person most qualified to talk about helping a pet with OCD symptoms would be Dr. Hogan, other than the few ideas I gave you about Chula. Dr. Hogan, do you have thoughts about that?
I do, and I will let you know that I specifically did research so I could answer really good quality, answer with good quality answers, just because as an emergency doctor, I don't get to have the opportunity to manage a lot of behavior cases on a long-term basis. They come into me on emergency. I recognize things, I document things, I give people good, good paths to go down. And so what is currently most recommended is clinical case canine compulsive disorder show treatment typically consists of a combination of environmental manipulation to reduce or remove initiatory stimuli and stressors, behavior modification to engage the dog in other behaviors, and pharmaceutical approaches. So it's not that you're just giving your dog a pill and patting them on the head and moving on. It's very much a more active process. It's a multi-tiered therapeutic approach to have the best optimization of outcome. And with there's one specific case that was a German Shepherd that did hyper grooming behavior. So he would started with tail chasing, and then the tail chasing escalated into flank biting. And he actually bit himself to the point that he was authentically injured and had to go into the hospital and have significant wound repair. And so they met with someone who was specifically a board certified veterinary behaviorist, and then went to a specific dog instructor and started him on the medications but then did a lot of redirective behaviors. So if he started going into a cycle of tail chasing, they would stop interrupt the behavior immediately and redirect him with something else that he still enjoyed. And so they would either, stop the behavior and quickly offer him some sort of a food treat that was a favorite treat, and then throw a ball or redirect the energy into a different activity. So he wasn't able to amp himself up and continue the behavior. And other things that they found were locomotor behavior. That was, I think the other thing that they had talked about was they found that if they exercised him, if he didn't have a lot of time that was more pent up energy, like when he'd first come out of his crate, because the people had worked for several hours and he'd have to spend time in his crate. When they'd first get home, they'd reward him, they'd take him out for a walk to go potty, but then not just a quick potty walk, it was a longer engagement where they engaged him and either took him for a longer walk, took him on different routes, so he had multiple stimuli of new smells, new sights, new sounds, and made it a long enough walk that he actually recognized that he had some exercise. So for a bigger dog, it was a 60-minute walk. For a smaller dog, it could be a much shorter walk, like maybe a 15 to 30-minute walk, depending on their health, their stamina, their size.
All right, thank you. There's a couple questions in the chat. Dr. Hogan, I might let you answer if you have answers to that, answer in the chat. We're going to go back to the PowerPoint and talk a little bit about exposure and response prevention ideas. And then if we have time at the end and people want to share their pets or show us their pets, we would love to see pets. And yeah, so let's jump back to Emily here.
Okay, technical issues. So these are just some ideas around exposure response prevention. When your OCD involves your pet, and as always, I very much encourage you to work with an OCD specialist, therapist, and get some more ideas that might be more specific to you. However, if you struggle with leaving your pet alone because you feel guilty or you're worried something's going to happen to them, practice, a very structured approach of leaving your pet alone for 3 minutes, going to the store, leaving them alone in the backyard, or even just leaving them alone in your apartment and going down the hall and work your way up. I mean, that's how you work on separation anxiety with dogs. And so it's a similar approach, because just like when parents need to work on increasing their own distress tolerance to seeing their children in distress, as a pet owner, you also need to work on your distress tolerance of your pet possibly being in distress, maybe being in distress. They might not be. They might be okay being alone, but that's a maybe. There's some uncertainty, right? I have some people who struggle with contaminations, so concerns, and we might have an exposure where they're feeding their pet and then not washing their hands afterwards, or preparing food and not washing their hands afterwards because their cat might lick their hands. And this is all within reason, maybe letting someone else watch your pet, someone else walk your pet. Those can all be exposures. And that response prevention is not seeking reassurance, not asking for a million updates if they're watching your pet. One time, for example, to use my own myself again, Stephanie was watching Harrison, and I was going away, and instead of seeking reassurance and asking for all updates, Stephanie sent pictures to my mom, because my mom doesn't have OCD around my dog, and wanted some updates. So that was okay. But that was hard for me, and it really helped because I wasn't seeking reassurance. And then some other sorts of response prevention. You know, maybe not all vets are going to be as compassionate as we heard today. And I think you can still be open and honest and really figure out what a normalized vet visit and frequency of vet visits look like. Harrison has discoid lupus and he has joint issues because he's a part corgi. And so for me, it was really looking at that middle ground between like when his conditions are in flare up and when I do need to take him to the vet to get that autoimmune disorder under control versus when it's something I can take care of at home, and really focus on reducing any reassurance seeking, so on and so forth. Anybody have anything to add? Yes.
His pink nose is very cute.
Thanks. Okay, I'm gonna go to the next one and turn it over to Maritza. If this goes. Not that one, this one.
Okay. So whether you have OCD or not.
First of all, hey Maritza, can I interrupt?
Yes.
I have to say, this is my dog Gracie and this is my dog Moxie, and Moxie is blind and deaf and has no teeth. So Gracie's, and we're in New Mexico traveling, and so Gracie is supporting Moxie. So there you go.
Yeah, this is sweet. So whenever you want to support a loved one who's a pet owner, or if you're a veterinary professional and you want to support someone, you know, naturally you want to provide them with reassurance, both because it helps their distress go down momentarily, but it also helps your own distress. You feel distressed when people you care about are distressed. But in the long run, whenever we provide reassurance to those who have OCD, it ends up causing the OCD to just be stronger. And it can be a vicious cycle because when you feel a little bit better, when someone provides you with reassurance, you just kind of keep wanting that reassurance. So there are other things you can do that would end up being more beneficial. So instead, you can empathize with them. Empathizing with them can validate their experience. You know, hearing this diagnosis is really scary. I would totally cry too. Or if someone has OCD, saying, you know, you're choosing to challenge this compulsion, and I know you feel uncomfortable right now. You're doing really hard work. Just hearing those words can be really helpful, and it's not providing reassurance. Also keeping in mind, as we touched on earlier, for many people, someone's pet is their best friend. Their pet is there when absolutely no one else is, providing you with unconditional love, and they can fill the role of being a child, a protector, a confidant, anything. And so when someone's animal's health is on the line, anyone in that position would feel like their world is just crashing down. So for me personally, I would always think, if I'm in their shoes, what would I want to hear? What would I need to receive in that moment? And so thinking about it in that fashion when you're in this position, I think is very helpful. And when someone has OCD, you can also provide them with support that does not involve accommodating. So accommodations would be if you're participating in or you're helping them perform a compulsion because of the obsessive thoughts they have. So first of all, if you've participated in the past, verbalizing, hey, I'm not going to participate is necessary. And you can probably anticipate some of their OCD symptoms being exacerbated during this transition if you're not helping them. And then also creating a response prevention plan can be helpful with your loved one. So a quick example would be, if I were to have OCD, I would say, when I feel anxious about Fluffy's health, I want to compulsively research symptoms to prove that he doesn't have cancer, and I want to constantly ask my partner if he's healthy. But instead of researching and asking my partner, I'm going to sit with that uncertainty. And I'm going to choose to play with Fluffy instead. If I catch myself researching, I'm going to turn off my computer. And if I ask my partner for reassurance, I have asked him to say, maybe Fluffy does have cancer. And that's scary to hear. But in the long run, that is what would be helpful for someone who has OCD to hear when they've created this plan ahead of time. Rachel or Emily, do y'all have anything to?
No, I think that's great. Just reiterate what you said about it is so tempting to just provide all sorts of reassurance and hope that will make things better, but ultimately it doesn't. So what you said about empathizing with them, being there with them in the emotional pain, but also helping them sit with the uncertainty that something bad could happen. We hope it doesn't. We're going to do our best in what we think is a reasonable approach, and then we're just going to let happen what happens. Yeah.
And when you're that person providing that support, like it is distressing for you too. So giving yourself that grace, like Dr. Hogan, I'm sure your job is not easy. You know, having to hold space for people when they're experiencing the worst day of their lives. It's hard on you too. So giving yourself that grace when you're the person trying to provide comfort is also equally as important, because if you burn out, who can be there for them, you know?
I've told people before, like when we're waiting for diagnostic results, to hope for the best, steel ourselves against the worst, and love them to bits, because that's the best option that we have right now.
All right. Well, thank you so much, everybody. I put a link in the chat. If you could fill out a post survey, that would be great. We love feedback. I also put my email in the chat. If you want me to send you the link to this talk, we're going to post that on our website. If you want to share it with friends, shoot me an email and I will send you the link once we get it posted. If anybody would like to show us their pets, we would love to see people's pets. I'm going to start by showing you a picture of Zia. This was actually getting close to the end before she died. She also had intervertebral disc disease, so she was paralyzed in her hind legs, and she had cataract surgery, but that is Zia. And then my two little ones are down here, probably getting ready to harass each other. Fortunately, they waited until the end of the session. But anybody else want to share their pets?
Gracie looks so cute with her little cone.
Oh, I know, she broke a nail, so that's why she has a cone on.
There's Harrison.
Nice. Hi, Harrison. I saw Harrison was watching you present, watching the video.
Oh, yeah, he was. There's
Loki.
Loki.
Hi, Loki.
Loki.
Aw. Sarah, what's your rescue's name again?
This is Hurley. We rescued him last night from a domestic violence situation. So he is currently in the transitioning phase of getting used to, I thank you, I love you too, getting used to a new environment. So he's been very clingy to me, which is, which is okay. He's dealing with a lot of uncertainty and anxiety in his own right now. So what he needs is to be just in the presence constantly. So it's like, okay, you can be in my library.
Devora, your little guy's underbite is just
I
adorable.
love it. What's his name or her name?
Weasley.
Weasley. Aw.
I had a cat named Weasley.
And Liz. Oh, Liz, what is yours?
Oh, hi. This is Martina.
Hi, Martina.
She's
Martina?
Martina, and she's 13. And what can I say? It's my love. And she's waiting to finish the Zoom to have a walk. So, so she's happy now. She knows we are finishing.
She can tell. Jen, you had your little one. What is your little one's name again?
Yeah, this is Reese. He's also a rescue. He's 11 years old. And I got him when he was 8 years old, the start of the pandemic.
He's tiny, tiny.
Yeah.
Thank you for rescuing a senior with a frosted face.
He's great. Thanks.
Anybody else want to show their pets?
Your dog looks so handsome, Stephanie.
Yes. Loki is definitely maybe wins the prize for regality.
I can show. My dog just ran downstairs. She usually sleeps. This is like her couch. I bought a leather couch just for my dog, apparently. But she just ran downstairs. But I could show you a photo. I was just organizing them. I have a Wiesla right here. But yeah, you could see it's like an old photo of us here. Just
that's adorable.
Yeah, big cuddler, as you could see. She's just. I was just looking at her photos, just kind of casually sleeping and with the teeth out. That's like the funniest way to sleep. So
thank you so much for sharing those.
Yeah, thank you for everybody else. It was great to see all the pups.
This is Scarlett. She's a very snuggly little kitty mix that I adopted. She's almost 6 now. I adopted her when she was 1.
Hi, Scarlett. Scarlett, do you recognize my voice? Scarlett. She's like, what is that?
Rachel.
Hi, Scarlett.
Scarlett just got in trouble for what? Oh no.
All right, well, thank you, everybody. I appreciate everybody sharing and asking questions and joining us. Like I said, email me if you want the link, and please fill out the post survey. We enjoyed having all of you.